So lastly, we're going to talk about ruminatorics and a few odds and ends in this GI drug category. And so what the heck is a ruminatoric? Must have to do with the rumen. In the past, when ruminants get sick, sometimes their rumen shuts down, and we need to have that rumen going at all times, contracting at all times, because that's part of the way that these animals digest. They're kind of continually digesting food in the rumen anyway. There's a certain number of normal ruminal contractions. I would quiz you if I had you in class as to how many there are. Hopefully, you've listened to some in sheep and goats and cattle. So it's important that we keep the ruminal contractions going. And producers in the past tried a variety of things. They tried some pretty toxic stuff, from strychnine to mercury, um, to just kind of irritate the rumen and get it going. And we have better drugs, so we don't use those things anymore. Obviously, that would be really bad to be feeding mercury to animals that are consumed or producing milk. Um, so one of the drugs that we use is neostigmine, and it's also known as Stiglin. This is an interesting drug in that it is going to stimulate the um, parasympathetic nervous system that controls digestion, right? So the way that it does it is it combines with acetylcholinesterase. And as you might um, gather from the end of that word, the A's part, it is an enzyme. It's an enzyme that destroys acetylcholine, the parasympathetic nervous system um, neurotransmitter. And so by doing that, by combining, by destroying that acetylcholinesterase, we keep more acetylcholine around. So the acetylcholine comes from stimulation of the parasympathetic nervous system, but it doesn't hang out forever. It gets degenerated, and it does it by this acetylcholinesterase. So if we interfere with it, we have more acetylcholine around. In other words, it's causing increased stimulation by the acetylcholine, increased parasympathetic nervous system stimulation. You will, in third semester, you're probably going to talk about a drug called, or a disease called myasthenia gravis. And this is also used to diagnose that particular condition. And it causes very dramatic, an animal that um, is basically paralyzed, it will bring them back to life temporarily, and then we have to use an oral drug to continue to treat that condition. But so the other thing that happens in animals with rumens is they will get bloat, and bloat is basically caused by an overgrowth of undesirable bacteria that produce gas. They can produce free gas that is just a bubble up on top of that mat that is in the rumen. There's sort of a mat of the fibrous kinds of parts of the diet, hay, and then underneath that there is the microflora and fauna and more digested food down below. And then up on top of that, there is gas, and a ruminant always has to eructate or belch. Um, if they can't belch, then they get this bloated condition. So we can have an obstruction in the esophagus that causes or choke is what we call that, where the animal cannot eructate and then that free gas builds up. But we can also just have conditions where the microflora and fauna are out of balance. It may be because we fed them too many grains, or something else has happened in there, and they're producing this free gas. Some of the eating alfalfa can cause too much alfalfa can cause a frothy bloat. A frothy bloat is like the gas is trapped in soap suds, like soap bubbles, and we have to pop those bubbles in some way. So what we can use for these types of bloats are DSS, docosate sodium succinate, if that looks familiar, it should. It helps in animals with constipation and relieving that surface tension on the feces and allows water to penetrate. Well, in this case, it interferes with the surface tension of bubbles and allows that frothy gas to escape and then be belched out. Um, we can also use mineral oil or vegetable oil to help with that frothy bloat. And then paloxylene, it also reduces surface tension and allows the frothy gas to uh, be eliminated. So we'll introduce these drugs via a stomach tube, or we can directly inject in the rumen. So this is an injection. This is a large bore needle. We would clip and clean this area in the paralumbar fossa. The rumen is over here. Here's the hind end of the animal, and the rumen is here. It's a very direct route in there. We don't have to worry about ribs in this case. And we'll just inject a large bore needle. In cattle, we'll use something called a trocar, which is a large instrument that we puncture. We'll go ahead and incise the hide, and then we'll go ahead and puncture through the body wall and into the rumen with this instrument. And this fits over this as we insert the trocar, and then we'll remove the sharp part, leaving behind this cannula. A cannula is simply a name for something that is an open tube. And then we can use that to introduce these things into the stomach, into the rumen, I'm sorry. A preventative for bloat are ionophores, and they basically act against the bad bacteria. So Monensin is one of those types of preventatives, and it just helps. Well, it's sometimes used in animal feed, and it will help to prevent the type of bacteria that produces the gas. All right. So I want to stress that Monensin should never be fed to horses because it is a feed additive. So that's why sometimes it can get mixed up in there. It'll be a grain-like material. It can cause it's potentially fatal to horses. I hope I didn't say you should never feed it to cattle. You should never feed it to horses because it can potentially be fatal in them. So a few other drugs that we're going to talk about, antimicrobials, except for what I just talked about, keeping the flora the right type. We don't usually use antimicrobials except for treating GI tract bacteria that may cause a problem. We're going to talk about oral electrolyte replacements and then pancreatic enzyme supplements and a little bit about corticosteroids. So sulfasalazine or azulfidine has an anti-inflammatory effect. If you remember, the salazine is like salicylic acid, so it's an aspirin-like drug, and that is why it causes that anti-inflammatory effect. It's cleaved off of a sulfa portion, and that is a sulfa antibacterial. And that has a potential to cause dry eye. So in the future, we think that they'll be producing drugs that emphasize the salazine part and do not cause the sulfa antibacterial part to be present with that potential for causing dry eye. We typically use these for, it's a local effect type drug in the intestinal tract. It's used for irritable bowel disease and colitis, and because it's pretty much just in the colon that it will have its effect. So that is a specific purpose for using sulfasalazine. Tylosin or Tylan is an antibacterial or antibiotic. It's used in swine and cattle. It can be used for treating certain types of bacteria in the GI tract, chlamydia, mycoplasma. It cannot be used in horses because it'll cause a severe diarrhea. It's going to affect their good bacteria. And then in dogs and cats, we can sometimes treat chronic colitis. It's an awkward drug to use in small animal because it's really formulated for large animal. Metronidazole is used to treat, hopefully you recognize this organism from parasitology, Giardia. Has that kind of tennis racket with two eyes sort of look to it. And we'll come back to it again in the antimicrobial section, but it does have an somewhat anti-inflammatory effect by reducing it from bacteria. It does have a very significant side effect in some animals of central nervous system signs, so head tilt, staggering, disorientation, in the worst case, seizures. So we have to be very careful with it, but typically if it's used at the formulary doses, we don't get into problems with that. But if an owner sees these signs, we want to stop it immediately because it's typically reversible. Again, we'll come back to this drug in the antimicrobial section of the course. We'll sometimes need to replace electrolytes. So where that can occur is when we have vomiting and diarrhea. With vomiting and diarrhea, we get loss of electrolytes and sodium, chloride, potassium. And so when we have that situation, we need to replace those. There are some over-the-counter type, we used to use like Gatorade and that sort of thing for small animals, but we have these better formulated for animal ones, and you can see these are large animal-oriented ones. It can be added to the water and get them kick-started or bounced back. So when we do have a lot of vomiting and diarrhea, especially these large animals can get profuse volumes of this. We need to replace it. So usually just used in the water for several days, and we get them back. They can also be added to feed. So some animals do not produce enough pancreatic enzymes, and we'll see this condition typically in dogs and cats. It's called exocrine pancreatic insufficiency, and they are not producing enough digestive enzymes. What ends up happening is they get a malabsorption, osmotic type diarrhea. It's very voluminous because the food isn't being absorbed or broken down. It is usually fats are the things that are hard to break down, so the feces will look like they are greasy and gross. So, but the bottom line is these animals lose a lot of weight, and so we will treat it with pancreatic enzyme supplements. So Viocase or Pancreazyme are two of these types of supplements. They are sometimes successful, sometimes not so successful. You can see this extremely emaciated kitty cat. Unfortunately, these enzymes get denatured in the stomach. The pancreas releases enzymes into the small intestine, into the duodenum, and so it's a more alkaline or less acidic environment, I should say. And so these drugs will be denatured by stomach acid. So we mix them with the food. The idea of mixing them with the food prior to feeding the food is that they will partially digest the food in the bowl. So we mix it into the food, let it digest the food, a little pre-digestion going on, and then feed it to the animal. So unfortunately, sometimes these animals do not regain their weight, but we can sometimes keep them going for a while more with these supplements. Steroids aren't typically used. You can see some problems maybe with giving steroids for GI tract conditions. We can potentially cause some problems, gastric ulceration. But one of the things that we can treat are immune-mediated types of diseases, and inflammatory bowel disease can be one of those sorts of conditions. So if you see eosinophilic gastroenteritis, this is just a little slide showing these eosinophils. This is one condition that we would use. So anything that's autoimmune, corticosteroids are appropriate for treatment to suppress the immune system, but otherwise we pretty much do not use steroids for treatment of gastrointestinal disease.